Hey y'all, welcome back to the channel. Andrea from Andrea Speaks TV here, back to bring you news and commentary you can use. Listen y'all, I'm back with more on the migrant crisis. This time, it has taken a turn, y'all, okay? I'm going to speak about a recent new thing that apparently is on the rise, okay, in a particular area. And it's somehow being tied to the migrant crisis, okay? Thank you so much. Listen, make sure you watch my migrant crisis coverage playlist here on the channel. I'll link it at the end of this video. All right, y'all, according to my sources, okay, a doctor rather has now issued a warning on the risk of polio in New York. Okay, now you may say, what in the world, polio? Yes, y'all, that's what I just said. Okay, now listen, my sources are saying that Dr. Mark Siegel, okay, who is a clinical professor of medicine at NYU Langone Medical Center and a Fox News contributor, issued a warning on Friday, okay, about the rising risk of polio in New York amid the migrant crisis. Listen to this, y'all, okay? In 2022, the first case of polio in New York since 1990 had been detected, okay, according to the New York State Department of Public Health, or the NYSDOH, as it's sometimes abbreviated, and the Center for Disease Control, or CDC, the Center for Disease Control and Prevention, rather, okay, commonly known as the CDC. The polio virus was not only found in someone who they say didn't have any of the things in the arms, okay, you know, though the word I'm talking about, right? They were y'all know what I'm talking about, right? This adult in Rockland County, okay, but was also found in several wastewater samples. Okay, now you've heard me mention before about how they're allegedly testing the wastewater. Why are they really doing that? What's behind that? Okay, so my sources say, but was also found in several wastewater samples from communities near the adult's residence. Now, in the late 1940s, okay, more than 35,000 people were paralyzed from polio in the U.S. every year, according to the CDC. Okay, but the V word, okay, in 1955, dramatically, okay, my sources are saying that it dramatically reduced the spread of the disease to less than 100 cases annually by the 1960s. Okay, so to kind of put polio in perspective, y'all, this is a disease that crippled many people, paralyzed them, and it's been around for several decades. Okay, as you can see, I referred to the 1940s, the 1950s, 1960s. Now, listen, y'all, the virus had also been eliminated from the U.S. by 1979, okay, still many years ago, right? Those sporadic cases, it says, that originated abroad have been identified over the years, okay? Now, my sources say that the symptoms of polio include fatigue, fever, headache, stiffness, muscle pain, and vomiting, okay? It can take up to 30 days, allegedly, for symptoms to show. It can also lead to permanent paralysis of the arms and legs, and even cause loss of life. Okay, now you may say, Andrea, you gave us all this information. How does it tie in now with the migrant crisis? Okay, I'm glad you asked that question. So, since there are so many migrants, okay, coming into the U.S. over the past year, there are now, okay, public health concerns, y'all. There are now public health concerns that have increased, okay, among those who they say are migrants, right? Okay. And that is fueling, okay, a rise, allegedly a rise in diseases such as chickenpox. Okay. So apparently what they're saying is, or what they're claiming, and I want to know your thoughts. Okay. Again, I'm not saying, I'm just here reporting the information, y'all. I'm not here pointing a finger saying, hey, this group is responsible, or, you know, that group is responsible. I'm just simply reporting information, and I would like to know your thoughts. So now the concern is, not only, according to my sources, not only are there several thousands, okay, sometimes tens or hundreds of thousands of migrants seemingly pouring in across our border, there is now, okay, reports of rising public health concerns, okay, over those migrants who may be y'all know what I'm saying, right? Y'all know what I'm talking about, right? Who are coming and allegedly spreading diseases, okay? Should that be a concern, or is this another way to put fear into people and to put thoughts of control. Let me know your thoughts, okay? Now, I gave you some figures, but now they're saying in the first 11 months of 2023, we already know it's almost 2024, they're saying that at least 2,953,678 migrants crossed either of the United States southwestern or northern borders, according to the data from the U.S. Customs and Border Protection, or the CBP. Okay, that's an increase, according to my sources, from recent years that has created a headache. Okay, what's called a headache for President Joe Biden, who has faced attacks from Republicans. Okay, the article says about border security. Okay. During a recent appearance on a news network, okay, Dr. Siegel discussed on Friday the influx of migrants and said that the crisis that we've talked about here on the channel, the crisis at the U.S.-Mexico border can also mean an increase in polio cases due to what they're calling the un-migrants, okay? Here is a quote from Dr. Siegel, who said, and I quote, "You just heard that half of the migrants, most of them pouring across the border, not having the thing against polio." Okay, y'all can read between the lines. He also said, and I quote, "We saw a case in New York State of polio first." Excuse me, y'all. First, let me start over. Okay, according to Dr. Siegel, he was quoted as saying, and I quote, "We saw a case in New York State of polio first since the 1970s. Wastewater in New York is now loaded with polio." Okay, and even if you had the polio V thing, right? He's saying you can still carry polio. Okay. He also said, and I quote, "I look at history through a medical lens, and I grant that this is a national security emergency." He's even calling it at the border, but it's also a public health emergency. Okay, so that's according to Dr. Siegel. Okay, I want to know your thoughts on this. Now, there were attempts to reach out by several news sources to reach out to the New York State Department of Health and the White House via email for comment. Dr. Siegel, who actually specializes, according to my sources, in internal medicine and treats conditions such as influenza, also explained, okay, that y'all know what I'm talking about, population adds to these public health concerns, okay? He went on to say that allegedly due to the migrants coming in who didn't also have the thing, that there were nearly 400 cases of chickenpox in Chicago that have been identified so far this year. Have we really heard? We've been talking about Chicago here on the channel, y'all. Have we really heard about any of this related to the migrants? I'm just not hearing about this, okay? And that's why I'm asking the question, are these concerns, are these legitimate concerns, or are they trying to put fear into the American people, okay? Are they trying to use this as a way to push a whole new thing? Okay, y'all, please let me know your thoughts on that, okay? Now, a spokesperson for the CDPH, okay, the Chicago Department of Public Health, told Newsweek earlier this month in a statement that their team is working to provide infection control guidance to shelters, okay? Here's a quote by the CDPH, who said, and I quote, "The Chicago Department of Public Health has a team dedicated to detecting and responding to reportable communicable diseases in shelters and other congregate settings. Cases of varicella have been reported in new arrivals, and in response, the team has consulted with shelter managers and other facilities to provide infection control guidance." Okay, that's according to their statement. Okay, so I want to know your thoughts on this. Does this add a whole nother level of growing concern to the current migrant crisis? I want to know your thoughts, okay? Take care, be blessed. Thank you so much for taking time to watch this video in its entirety. I want to invite you to subscribe if you haven't already. Join our community and let me know your thoughts in the comments, okay? See you in the next video. Take care, be blessed, and thanks so much for supporting me here on Andrea Speaks TV.